California, plastic surgery is almost a way of life for those with money and vanity, but complications with general anesthesia have some people thinking twice before going under the knife.
One local plastic surgeon has now developed a technique that he says takes all the danger, or at least most of it, out of the facelift. His patients are wide awake, but they don't feel anything. Health reporter Marta Waller here watching him work. They don't feel anything?
Not a thing.
Interesting.
Not a thing. In fact, it's called the Simoni Lift. It takes an hour. Patients are not only awake during the procedure, they can actually talk to the surgeon while he is operating on them.
Good morning. How are you today?
I'm good.
At age 58, Magda Bobrowski doesn't like some things about her face.
I don't like the lower part of my face and the neck.
Problem is, she's a smoker, and most plastic surgeons wouldn't touch her face unless she quit, because putting a smoker under general anesthesia creates additional risk. But today, Magda's in luck because of a new procedure called the Simoni Lift. She'll be awake during the entire operation, which will take place in an operating room that looks more like a spa than a doctor's office.
Good morning, Magda. How are you, sweetheart?
Beverly Hills plastic surgeon Dr. Payman Simoni developed the technique in response to concerns about complications and some deaths due to general anesthesia during plastic surgery.
Since I took the anesthesia away, the patient's sitting up. I can see them during the talking. I can see the movement of their face, and I move it in an angle that is more natural.
Dr. Simoni shows Magda what he will be doing as he marks her face before surgery.
In an hour, we'll see you 15 years younger.
Once in the OR, which also has a spa feeling complete with music and a foot masseuse, Magda gets comfortable. Within 5 minutes, one side of her face is numb. It's the only discomfort she'll experience.
Are you ready?
I'm ready.
As Dr. Simoni makes his incisions, there is very little bleeding. Dr. Simoni says general anesthesia causes blood vessels to expand and bleed because everything is relaxed.
The amount of the blood loss with this procedure is less than getting a nosebleed.
And that means less swelling, less bruising, and far less downtime.
4 days to 7 days, and everybody's different. They can go back to work, and they can start their life. They don't have to hide in home for 2 weeks.
An hour after the surgery began, Magda's lower face and neck have been lifted and tightened. Those things she didn't like are gone, and despite a little swelling, Magda is well on her way to looking like she did 10 or 15 years ago.
Well, looks good. Feels great.
And you feel?
I feel great. I really do feel great.
One short week later, Dr. Simoni removes the sutures. The swelling is gone, and there is no bruising.
I feel great. I like the way I look. And I also like the way I felt right afterwards. I look good. As a matter of fact, the same evening when I took the bandage off to dress my face, I looked at my neck and I said, this is all gone. Just gone. All this stuff that I hated so much.
And Magda's facelift cost about $7,000. That's a few $1,000s less than if she had to pay an anesthesiologist to be asleep during the operation. She went back to work 5 days after her surgery. She says each day she looks a little bit better. Tomorrow night we're going to take a look at the liquid lift, which promises to take years off your face without a scalpel.
It's amazing. It really is what they can do. But,
Yeah.
you know, is this the only wide-awake facial that, you know?
No, there are others available, but Dr. Simoni is double board certified otolaryngology, which is head and neck, and also he is certified by the American Board of Plastic Surgeons. You need to make sure that your plastic surgeon has that certification as well. They don't all have that, and this is very, very important when you go and have this surgery.
Quicker healing, and it's cheaper, man. You
Less
can't lose.
expensive, and she looks great.
All right,
She
thanks.
does.
Thank you very much, Marta.